So now we're going to go over the common vaginal infections. Bacterial vaginosis, trichomoniasis, and Candida vulvovaginitis are vaginal infections. Of these, only trichomoniasis is an STD. Let's start with how they compare in terms of symptoms. Bacterial vaginosis is caused by the bacterium Gardnerella vaginalis. It is non-inflammatory and causes a malodorous discharge with a fishy smell. Next, we have trichomoniasis. It is caused by the protozoan Trichomonas vaginalis. This presents with vaginitis or inflammation of the vagina and strawberry-colored mucosa. Candida vulvovaginitis is caused by Candida. Here there's also inflammation and a characteristic cottage cheese discharge is formed. Vaginosis is diagnosed by a whiff test, which will allow you to sense the characteristic odor. It will also help you detect the presence of clue cells on microscopy. Now, what are clue cells? They are epithelial cells that have had bacteria adhere to their surface, obscuring their borders and imparting a, quote, stippled appearance. You can see the clue cell in this image, where the cell has a stippled appearance due to the bacteria covering the cell's exterior and causing this appearance. In contrast with trichomoniasis, you will see on a wet prep motile protozoa. For the Candida wet prep, you'll see pseudohyphae under the microscope. This is the only case of vaginal infections where the vaginal pH remains normal, aka below 4.5. Both vaginosis and trichomoniasis are treated with metronidazole. With trichomoniasis, however, you need to treat the partner as well. For Candida, which is the only fungal infection of these three, you'd want to treat with an antifungal, such as an azole. But don't worry, we're going to cover antifungals in the antimicrobial section of this chapter. So what are the torches infections again? Well, the torches infections have been mentioned several times throughout the microbiology chapter. Basically, the torches infections are a collection of pathogens that can cause congenital defects when passed from a mother to a developing fetus. The reason they're called torches infections is because it's a mnemonic that's used to remember them. Toxoplasma gondii, rubella, CMV, HIV and HSV2, and then finally syphilis. While considered in this category, HSV and HIV technically do not cause congenital defects, and so they're not actually technically congenital infections. You're going to realize why in a moment. But before we go into it in a little bit more detail and talk about the torches infections, I'm going to talk a little bit about some runners-up to this list. They include Strep egalactiaea, aka GBS, E. coli, and Listeria, all of which can cause meningitis in neonates. However, meningitis is not a congenital defect, and therefore they don't quite fit into the torches category. Another one is parvovirus B19, which passes the placenta and causes a congenital defect, specifically Hydrops fetalis. One more bug to think about is chlamydia, which can cause pneumonia and conjunctivitis, usually seen in the second week. But again, conjunctivitis is not a congenital defect. So now, let's go through the torches infections one by one. Toxoplasma gondii is most commonly acquired from cat feces and is usually asymptomatic. However, when passed from mother to neonate, it can cause a classic triad of chorioretinitis, hydrocephalus, and intracranial calcifications that you can see on brain imaging, such as MRI. Toxoplasmosis can also cause brain lesions in patients infected with HIV, which is usually due to reactivation of toxo, as opposed to newly acquired toxo. Rubella is often acquired through respiratory droplets and can cause rash, lymphadenopathy, and arthritis in affected individuals. When it is passed from a mother to fetus, it causes different symptoms. One of these is patent ductus arteriosus, which is a defect in the embryological formation of the heart. It can also cause cataracts and/or deafness, as well as its main buzzword, blueberry muffin rash. This image shows a young child with cloudy eye lenses, which is what a cataract is. This child has these cataracts as a result of congenital rubella. Bear in mind that congenital rubella is rarely seen in the US today because of the extensive use of the MMR vaccine, which vaccinates against rubella in the R portion of the vaccine. Cytomegalovirus is a very common pathogen, and it's likely that most people have it. It can be acquired, however, through sexual contact, organ transplant, and other forms of contact. It's almost always asymptomatic and only really causes problems in patients who are immunocompromised, such as those with HIV, or when passed from a mother to a fetus, in which case it can cause hearing loss, seizures, and a petechial rash, or possibly our lovely blueberry muffin rash again. Remember that CMV is the most common cause of congenital defects in the US today. HIV is obviously also a sexually transmitted disease. We've talked about HIV before, and we've already mentioned how it can have a variable presentation depending on its CD4 count. When it's passed from mother to fetus, it can cause recurrent infections and chronic diarrhea. Even though it's technically considered a tortuous infection, the manifestations that I've described are not congenital defects per se. Remember that HSV2 is usually the genital herpes, while HSV1 is the oral herpes. The herpes simplex virus 2 can be acquired through skin or mucous membrane contact. It is usually asymptomatic, but it can cause herpetic or vesicular lesions. This infant has a maculopapular outbreak on his feet due to congenitally acquired HSV. Its effects on neonates who acquire it from their mother are much more serious. In addition to these herpetic lesions, the infants may have encephalitis. As with HIV, these are not really congenital defects per se. Lastly, syphilis is also a sexually transmitted disease. As was discussed earlier in the microbiology section, primary syphilis can cause chancres, while secondary syphilis can cause a disseminated rash. Finally, with tertiary syphilis, you can have cardiac or neurologic disease. Unfortunately, when it is passed to the fetus, it is often deadly and results in stillbirth as a result of hydrops fetalis. If the child survives, he or she can present with many facial abnormalities that will manifest later in life. These include notched teeth, known as Hutchinson teeth, which is characterized by a triangular-shaped incisor. You can also have a saddle nose, short maxilla, cranial nerve 8 deafness, and Sabershins. Sabershins are also known as osteoperiostitis of the tibia and appears as a sharp anterior bowing of the tibia, which you can see in this image. So, now we're going to talk about the red rashes of childhood. Let's say you get a test question and it asks you about a child who comes in with a rash. Usually, you'll read a description or see a picture of the rash, such as vesicular, macular, maculopapular, purpuric, etc. You'll also get information about the location and the duration of the rash. And then they're going to ultimately ask you, what kind of microorganism can cause this? Unfortunately, there are many different bugs that can cause rashes, but I'm going to go through the major ones to try to help you differentiate between them. Let's start with Coxsackie. Coxsackie virus type A causes hand, foot, and mouth disease, which is a vesicular rash on the palms and soles. It can also cause vesicles and ulcers in the oral mucosa, hence the mouth part of its name. You can see what the rash looks like in these pictures. HHV6 can cause roseola, which is a macular rash over the entire body. This usually appears several days after a high fever and usually affects infants. Let's talk about the measles virus. The rash of measles virus begins at the head and moves downwards. The image here helps you realize what the rash looks like. One key characteristic with measles is that in the case of measles virus, the rash is often preceded by a cough, coryza, aka a runny nose, and conjunctivitis. These are the 3 C's of measles. Another manifestation of measles is Koplik spots, which you can see on this image. They are also known as blue-white spots on the buccal mucosa. In this case, parvovirus causes erythema infectiosum. Another name for this is slap cheek disease due to the red rash seen on the cheeks of patients that you can see in this image. Remember that in adults, it causes arthritis with no rash, and in pregnant women, it is very lethal to the fetus because it causes hydrops fetalis and ultimately abortion of the fetus. Next up, we have rubella. Rubella causes a rash that begins at the head and moves downward. Another manifestation of rubella is that it causes post-auricular lymphadenopathy. Next up, we have strep pyogenes, which causes scarlet fever. Scarlet fever manifests with an erythematous, sandpaper-like rash, which you can see in this image. This patient will also suffer with fever and a sore throat. It can also present with a strawberry tongue, which you can see in this image. You may recall that a strawberry tongue can present in different diseases. Do you remember what other disease a strawberry tongue presents with? That's right, Kawasaki disease, which is a vasculitic disease. Take a look at the cardiology section for more information on Kawasaki disease. Lastly, we have VZV, which causes chickenpox. In this case, the rash usually begins on the trunk and spreads out to the face and extremities. This image shows what the rash looks like. What's important to keep in mind with chickenpox is that many lesions manifest with vesicles. Another thing with chickenpox is that the vesicles will appear to be of different ages. So in some cases you'll have lesions that appear to be new. These will be the macules and the papules. However, the later ones will appear to be older. These will be the vesicles and the pustules. Which virus causes a childhood rash on the palms and soles? Next question. Which 2 viruses begin on the head and move downward? That's right, you remembered correctly. The virus that causes a childhood rash on the palms and the soles is Coxsackie virus. You will remember with my beautiful diagram that measles and rubella both begin at the head and then move downwards.